I'm a family doc. I practice family medicine, and I've been practicing for 7 years. I have a LPN and an office manager. There's a small staff, and we see about 30 to 35 patients a day. I would never be able to do that with a paper record. I wouldn't be able to have the low overhead that I have. My first endeavor with an electronic medical record didn't go so well. And in the process of struggling with that, I learned about the Allscripts Myway product and looked at what it had to offer. We were up and running in a very short period of time, and the technical support and customer service has been phenomenal.
You can have a seat right here.
If we ever have issues or problems, there's always someone we can either email or call. I would recommend Allscripts Myway to a smaller practice.
Ever had the symptoms before?
No, I have not.
Okay.
Because I feel that it's easier, it's geared more towards the small practice. You can change things when you need to change things.
The first thing that I liked about it was that it wasn't template driven, it is chief complaint driven. And as a primary care provider and a family doc, I see patients for a lot of different reasons. Their chief complaints don't necessarily fit into a nice tight little template. There's actually a feature that I can press and it brings up pretty much all of what I put in for the last visit, and I can just click off the things that are pertinent, what's improved, what's worsened. It allows me to monitor labs more closely. Labs are automatically populated in the chart.
Vaccines are easy to access. All I have to do is point and click on the vaccine record and I can pull up and I know immediately what someone has had or missing.
The medication list and allergy list in the Myway product is very easy to use. It's quickly accessible. Every time I prescribe a drug, the program actually runs an interaction check and gives me a screen telling me what the interaction is. The other thing is it improves my quality of life because I'm not searching for these things. My notes are finished within a half hour of the end of my day. By the time that my last patient leaves and checks out, I'm maybe about 10 minutes behind that last patient checking out. We run on time. People aren't in my waiting room for an hour and a half to 2 hours waiting for me.
When my records are collected electronically, it makes me feel like I am his only patient. And they're ready for me, I'm not waiting for hours, and they're not fumbling through papers, trying to remember who I am. It's all right on their screen, and I feel very safe.
The Myway product also has e-prescribing embedded in it.
He writes the prescription and he submits it electronically and then just tells me to pick it up on my way home.
The Allscripts Myway product also has formularies embedded into the system so that when you're choosing an antibiotic or antihypertensive medication for a patient, you know what's covered and a lot of times at what level. It helps with compliance. If it's not costing them, you know, $100 a month for their prescriptions, they're generally likely to fill them. I have a hosted system with Myway, and that allows me access into my system from pretty much anywhere where I have an internet connection. With the hosted environment, I feel like my data is extremely secure. I know that it's actually backed up on several different places throughout the country. I think I've definitely had a good return on investment for the Myway product. I think that the amount that the product cost me is easily defrayed just in the payroll savings for what it would cost me for a medical records person or 2 medical records people. Also storage space. The Allscripts company has met my requirements, has exceeded them. I would highly recommend that any small practices use the Myway product, especially a primary care practice that needs to keep overhead low.